Hi, everybody. My name is Liz, and welcome to my lightning talk titled Reflective Practice, Keeping Staff Connected to Themselves, Each Other, and Clients to Prevent Burnout. I'm a licensed clinical social worker who's been practicing therapy. I'm also endorsed as an infant mental health professional in the state of Wisconsin. I have a postmaster's certificate in infant mental health, a postmaster's certificate in trauma counseling, and I'm trained in neuro-relational framework, trauma-informed care, child-parent psychotherapy, and reflective supervision. The information that you will hear today will be based in my years of experience of being a reflective practice participant and provider. I have received reflective consultation from statewide and national leaders in infant mental health and reflective practice. I've provided reflective practice to home visiting programs, child welfare case managers, therapists, social workers, behavioral health case managers, and nurses. I believe that we have the ability to be trauma-informed in all fields that are provided for people and by people with the implementation of reflective practice in those fields. Reflective practice, or also known as reflective supervision or reflective consultation, is recognized as an approach that supports and aligns with trauma-informed care principles. It helps to create an organizational climate and culture of safety, trust, and collaboration with shared exploration. Engaging in reflective practice has a positive effect on agency practice and functioning. The use of reflective supervision is associated with increased client engagement and their goal attainment, reduction in burnout and staff turnover, and increased job satisfaction. Parallel processing of emotions in a relationship is a foundational concept of infant mental health. As a result, reflective practice is a staple in the infant and early childhood field to help us understand what we bring to the client-provider relationship as a tool for intervention. It's my favorite intervention, to be honest. There are parallels in the parent-child relationship, the parent-provider relationship, and provider-supervisor or agency relationships. Even our own lived experiences can impact our perspective and unconscious biases in a case. Therefore, how we show up and how we view the dynamics of the case has a direct impact on the case. But reflective consultation and practice doesn't need to just be housed in the community of infant and early childhood clinicians and child care providers. In fact, this way of reflecting on our cases should be available to all clinicians and medical providers, as well as teachers, anybody working with kids or people. From a research perspective, it is highly underutilized and has the potential to be an imperative component to stabilizing the emotional needs of a workforce subjected to vicarious trauma. That's why this is my passion, and I'm bringing it here to you today. Integrating reflective practice within and throughout all levels of an agency helps to create a more effective, healthier workforce. Reflection increases self-awareness, the ability to pause and consider multiple perspectives, exploring approaches and options, and maintain a curious stance on all our cases. The act of pausing and considering what's happening inside and outside of one's body and mind utilizes the executive functioning skills of the brain, such as self-reflection, memory, and emotional processing. Emily Fenchanel was an LCSW who was a longtime editor at the National 0 to 3s Journal and one of the first coordinators of the 0 to 3 National Training Institute. She identified these three key elements of reflective supervision, which are collaboration, regular, and relationship-based. When we talk about collaboration, we talk about approaching a problem or shared goal by working together and exchanging ideas. Reflective practice is based on a collaborative relationship which exists when both people view each other as partners, with each providing expertise and knowledge that will help the family and the staff reach their goals. Reflective time is considered to be scheduled consistently in a predictable manner. Staff members need to know when it will occur and how often. A sense of predictability will help establish safety and commitment, as well as deepen the practice. Reflective practice involves thoughtful consideration of all the relationships, perspectives, and emotions of each person directly or indirectly involved with the family. It involves careful exploration of the parallel process. It can be done individually, in a group, or both. Emotional safety in the context of the reflective practice relationship is essential for genuine reflection to take place. Individuals must have trust in themselves, their peers, their supervisors, and their leaders to engage in a deeper exploration of their work. Without safety, this reflective process will likely stay at the surface, resulting in a practice that lacks authenticity and meaning and doesn't yield desired outcomes. This is very important to consider when considering if the reflective practice will take place in individual or group settings and who will be included in those group settings. So clinical supervision is different in that it focuses on administrative content such as oversight of federal, state, and agency regulations, program policies, rules and procedures, as well as reviewing casework, diagnostic impressions, interventions, the treatment plan, and overall clinical process. It involves content around training, education, oversight of paperwork, documentation, rules and procedures, and monitoring productivity and valuation benchmarks. All the boring stuff. For me, reflective supervision is the fun stuff. And I would not advise for reflective supervision or consultation to take place at the same time as clinical supervision as a result of the deep, meaningful conversations that will result in that type of work together. So reflective supervision is generally provided by a supervisor within the agency or organization. It can be provided individually or in a group and can be done by the same person doing administrative and or the clinical supervision. Another way to build professional reflective capacities is for an agency to contract with a consultant outside of the agency to provide individual or group reflective consultation, which would be different than a supervisory role. Regardless of whether or not it's provided within an agency or through an outside consultant, the goal is to create an environment in which people do their best thinking about their work with young children, families, and staff members. One characterized again by safety, calmness, and support. Experts in this field strongly recommend that someone receives reflective supervision before providing it to others and that they continue to receive it while supporting others. This will honor the parallel process. I would love to share more about the importance of reflective practice and how you can implement it in your agency. Please feel free to connect with me on LinkedIn for more information. Thank you.